Hi, my name is Jennifer Abdul-Rahman, and I chose the topic of the need for cultural diversity in the nursing profession, and it falls under the category of transcultural nursing. We're going to discuss cultural diversity within nursing education, the nursing workforce, and the patient population. Also discuss strategies to increase cultural competence in the workplace, and explore how diversity awareness affects patient care. Transcultural nursing is providing culturally competent and culturally specific nursing care, which is customized to fit the patient's own cultural values, beliefs, traditions, practices, and lifestyle. Madeline Leininger developed transcultural nursing in the 1950s. She noticed the need to prepare nurses with education and research to care for those that are culturally different or minority subgroups which may be vulnerable and provide them with competent care. Transcultural nursing applied. We need to realize that, look at the statistics and do realize that there is a disparity between white and Caucasian and those of minority subgroups within the nursing practice. We have a lot of patients that are of different cultural backgrounds, but we don't have a lot of nursing students or nurses of those same cultural backgrounds. The majority is white and Caucasian, which can create issues with trust between healthcare workers and the patients, and also patients may lack confidence in their healthcare team if they're not able to trust those that are taking care of them. One of the main issues is actually getting people from minority subgroups into the nursing profession. A lot of agencies do provide scholarships to minorities, but then they also meet the obstacle that there aren't a lot of educators within the nursing profession either. So nursing students don't always feel confident or feel that they can trust the educators because they may not understand their own cultural beliefs and backgrounds. Diversity awareness versus diversity self-awareness, being aware of other cultures and other people's practices and things that they say and things that they do, and also being self-aware of our culture and realizing that our culture may be different from somebody else's and looking at how we perceive somebody else and that they may perceive us differently as well. Developing cultural competence is really being confident in the care that we're providing and being confident in our interactions with our patients and with our coworkers of different cultural backgrounds. Exploring cultural backgrounds of coworkers, this leads to more trust and more understanding when we can learn more about people's cultural backgrounds and why they may do the things they do or say the things they do. Assessing the cultural background of patients on admission. This is extremely important, especially concerning dietary restrictions or certain foods or drinks that may be popular in that culture, especially when you're prescribing new medications that could interact with those food or drinks. And also understanding their lifestyle, and they may have things that they do daily that are very important to their culture and religion, and really having a respect for that will increase the patient's trust and confidence in the healthcare team if we can provide care to them that works within the framework of their culture. Cultural workplace competence. This is a nice mnemonic that just lists a lot of words and actions that we should keep in mind when we're working with our coworkers. Realizing that people are multidimensional and that they may associate with one or more cultures is really important. Being proactive, ethics, trust, education, continuous learning, really caring about what people have to say and really caring about their culture and how it affects their work ethic. And this will increase confidence in us with dealing with people of various cultures, and also continuously evaluating what we're doing and saying and if it's really appropriate for the situation. These are some scenarios. I'm actually going to post these in the post because I'm not going to have enough time to read them all thoroughly, but after reading these, I hope you can understand why it's so important to be confident in our care and have confidence in ourselves in dealing with our coworkers and our patients of various cultural backgrounds, and really understanding why it's important, especially concerning medications, and just making our patients feel confident in us and have trust in us in providing care to them. I'm just going to read the first one because this is actually a personal experience for me. And when reading some of the articles and the examples, you kind of wonder, how can people be this ignorant or how can they say these things? But I think these things happen a lot more often than we maybe notice. And that's all about cultural awareness too, is noticing that these things are happening and being able to correct them. So the first example, there is a nurse that works on the unit who wears a headscarf and identifies as Muslim. There is an Arab patient and another nurse asks the Muslim nurse to translate for her Arab patient. The Muslim nurse says she does not speak Arabic, and the nurse says, "What do you mean? You are Arab." The Muslim nurse responds, "I am Muslim, not Arab. Not all Muslims are Arab, and not all Arabs are Muslim." So I hope you can all see what's wrong with that situation, and why that could be harmful to the work environment and create problems between coworkers. And that doesn't only go for coworkers, it goes for patients as well. So I'm going to post those in the discussion board post. By 2050, minorities are projected to make up 54% of the U.S. population. They will no longer be considered the minority, but instead the majority. Minority children are projected to reach this milestone by 2030. This is extremely profound and really shows the impact that it's going to have on our culture in the United States and also on the healthcare system, and why we need to be culturally competent and why we need to learn about other cultures and accept other cultures and religions, and really be confident in our care, because minorities will make up the majority of the population by those years, and we need to be able to provide them with the appropriate care that they need. And my references list. Alright, thank you for your time, and I hope you enjoyed the presentation, and I'm going to post the rest of those scenarios in the discussion board so that you can read them more thoroughly.